I actually began here in early 2017 and coming from both Connecticut as well as Rhode Island in the past. And I've been involved with graduate medical education for about 10 years or so, having various roles over that time. I originally was a faculty member out of a chief residency in Chicago, and then a core faculty member after that, associate program director, and then eventually the residency program director. Along the way, I've also had an opportunity to be involved with the administrative side of things, namely being a clinic director as well as a medical director for another facility in Rhode Island. So my primary love generally is working with residents and students. That's what I love to do. I'm a primary care general internist by training. However, the thing which gets me excited in the morning and puts a smile on my face throughout the day is working with the residents and medical students. United Health Services has its own mission and vision. And what I've done today is actually bring a copy of that because I want to make sure that our potential residents and students too understand what that is. And just for the purposes of this, I want to go ahead and read that. So the mission for United Health Services is to improve the health of those we serve through our commitment to excellence in all that we do, and to be the region's leading integrated healthcare system, demonstrate exceptional value, and deliver coordinated patient-centered care. So that is our mission as well as our vision for United Health Services in general. And I think that all the residency programs, internal medicine, transitional and preliminary year included, support that to a T. That being said, one of the very first things I did when I came here was try to translate that and distill it down into a similar mission and vision for the residency program. And again, I'm speaking mostly about internal medicine here, and I'll share that with you as well. So that is to provide evidence-based didactics and pragmatic patient-centered training across diverse inpatient, outpatient, acute, and longitudinal care settings so that our graduates qualify for and successfully pass the certification exam and subsequently perform superiorly in primary care, hospitals, medicine, or fellowships as desired. Now that I know is a mouthful, but every single word in that statement was crafted for a specific reason. Based upon that program level mission and vision, what we have done is, as a program, is to try to structure our overall goals and objectives, our curricula, our schedules, block schedules, call schedules, and so forth, and all of our didactics, and generally our curricula in general, has been customized and designed just to support that mission and vision. And I think we've succeeded. There are several different methods that we are using to try to target and improve on that mission and vision on an operational level. And that's something that we consider to be in partnership with our current residents as well as our administrative staff and the hospital staff as well, to try to tailor it to the institution, at the institutional level I should say, as well as at the program level. The United Health Services internal medicine residency program has been in place for about 50 years. It's fully accredited by the ACGME, which is the body that has to accredit residency programs and fellowship programs in this country. And so we've had a very successful long-term relationship with the ACGME, and what's resulted in continued accreditation for an extended period of time. So what we've done is to try to build upon our past as much as possible. And essentially what we try to do is welcome all potential medical doctors as well as osteopathic physicians into our program so that they can continue and build upon our history. So what we try to do is ask them first and foremost, well, what do they want to do? What do you want to do when it comes time for you to graduate? Are you interested in primary care? Are you interested in hospital medicine? Are you interested in fellowship, administration, or some combination thereof? And what we try to do is not only to meet the minimum requirements, of course, that any residency program has to, but we also try to customize our program to the needs and desires of the individual candidates. So by the time they finish their first year of residency, most residents really know what they want to do after they graduate, or if they're not sure, they probably have a good idea. And in their second and third year, we try to customize that as much as possible to allow them to succeed. So over that second and third year of training, their block schedule, their rotations in general are customized to the needs that they have or that they want to meet by the time they graduate. So we offer, I think, a very rigorous curricula here, which is fully compliant with the minimum standards for any residency program in this country, but then we go forward and try to customize that to the needs and desires of our residents.